Am I ready for a facelift?
If you're looking in the mirror and pulling up the sides of your face, you may be asking if this is the right time for you to have a facelift. I'll try to help you understand how I approach this question in my practice every day. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I've been performing every type of facelift, from short scar quick recovery to deep plane face and neck lifts in my practice throughout my career. I would also add that although I'm a surgeon, I have integrated many minimally invasive advances to help my patients concerned about their facial aging changes. This includes specific methods to treat volume loss, skin quality, the use of suture-based suspension, as well as non-surgical skin tightening. Men and women come to see me every day with concerns about looking more aged and appearing tired. What's particularly bothersome for these patients is that they feel their appearance on the outside doesn't match how they feel on the inside. When a patient comes in for an evaluation for a facelift, I start by taking pictures from different angles at rest and with expression. I ask the patient to look at their photo and state what they feel is the most significant areas which concern them. Of course, many times they look and they say everything. I then systematically review with them what I see in the upper, middle, and lower third of the face. A perspective which is particularly helpful is a 3/4 and side view. I look for the presence of jowls and sagging neck skin. If these areas are significant, I move the cheek and neck upward and back to see if there's enough laxity to perform a facelift or face and neck lift. I also educate my patients about understanding that facial aging is not just about loose skin, which is sagging, but facial aging is significantly affected by progressive bone loss. This means that volume correction has an important role in helping you look better with or without facelift surgery. In the past, it was often that a woman in her 50s would come in feeling that her face was losing its youthful appearance, and I would subsequently recommend a facelift procedure. Oftentimes, these were short scar facelifts, sometimes referred to as mini lifts. Currently, if there isn't significant sagging of the skin, rather than recommend a short scar facelift, I educate my patients about how bone loss and soft tissue loss is more responsible for their facial aging changes. I discuss considering volume correction with a method called structural volumizing using a long-lasting filler such as Juvederm Ultra Plus or Juvederm Voluma. It's very common for patients to be afraid of looking pillowy or puffy after having fillers, citing friends and celebrities who they feel look unnatural. I explain how traditional filler placement is performed at the skin level in a skin structure called the dermis, or just below the skin. This means that the weight and shape of the filler can have a significant negative impact on aging skin, which tends to be thin and loose. When I perform structural volumizing, I apply my surgical knowledge and experience, particularly with facial implants, to place the fillers at the bone level comfortably with little risk for bruising. This is ideal since the bone level is where the most significant volume loss has occurred. In contrast with traditional methods which can make the skin look puffy, this technique actually results in improvement of the definition of bone structure and restores shape in a way which looks more youthful. For many patients who are considering facelift, this procedure works out very well without surgery. If there is significant skin sagging, a facelift can be performed and structural volumizing can be performed after surgery. The main goal of facelift or face and neck lift surgery is to restore the anatomy of the sagging tissue to improve cheek position, jawline definition, and improve the neck angle. My facelift patients are mostly women in their 60s and older. Prior to surgery, I always review the medical history and the results of the most recent physical exam from their medical doctor, including diagnostic testing such as EKG and blood work. In terms of medical history, most people who have well-controlled conditions such as high blood pressure or diabetes can undergo surgery safely. I am particularly concerned about patients who smoke, as the effect of smoking on the blood supply to the skin can be a problem for optimal healing. In my practice, I routinely perform all types of facelift surgery, from short scar mini lifts to deep plane face and neck lift surgery under local anesthesia with light IV or intravenous sedation. This is in contrast to traditional surgery, which is performed under general anesthesia. My patients appreciate how good they feel immediately after surgery and how quickly they're able to recover. After surgery, a dressing is placed, which is removed the next day. I generally suggest taking 1 to 2 weeks off work, depending on the extent of surgery to be performed. The facelift has been the gold standard for helping people address the anatomic changes of aging, particularly sagging and jowling. In my practice, my approach to recommending a facelift is now part of a range of options which I customize to meet the needs of each individual patient. No two faces are the same, so every face has to be looked at individually. I hope you found this information helpful. Thank you for your question.